Hello, my name is Javier Fleites, PA student second year, and this is my video recorder for my OSCE examination for my family practice rotation. I'm going to be using case number 3 on page 70 of the US MLE book. Mr. Rossetti today is going to be performing Egna West, 65-year-old patient who comes to the office, and he's going to be reading the first part because he doesn't know the lines. So once he's done with that part, I'm going to throw that out to make sure it's not in the examining area. This is going to be my examining area here, which is kind of restricted. So I'm going to be moving back and forth. I'm going to be using this in case I need to do any notation. There's nothing on it, totally empty. And we're going to be starting exactly on the minute. Let's see how much we can cover here. Okay, and we're going to start now. Hello, how are you doing today?
Good, thank you.
Okay, my name is Javier Fleites. I'm a PA student from second year. I'm going to be helping you today. Could you double check your name for me?
Egna West,
Egna, what's your age?
65,
Okay, you retired, do you still work?
and a seamstress.
Okay, you're a seamstress. And what brings you in the office today?
I came to see you because lately I find myself asking my husband to repeat things because I can hear well the first time he say things. 2 days ago, I went to the movies and I had trouble hearing the dialogue.
Okay, and when did you start noticing that hearing loss?
It started gradually, 6 months ago.
Is it both ears equally or more one side than the other one?
It's more on the left side.
Okay, that left side, do you hear something or you don't hear anything at all?
Oh, I do hear something, but not much.
Do you have any vertigo or dizziness associated with the hearing loss?
No,
What about any ringing of the ear?
no,
Any ear discharges?
no,
Any pain?
none,
Any trauma associated with that side of the head or the ear?
no,
Have you been exposed to loud noises like, for example, armed forces or if you work in a factory like machinery noise, something like that?
no. I never was on the armed forces and on a seamstress.
Okay, what about any recurrent viral infection or ear infections during their childhood or later on in life?
No,
What about any medications that could be associated to the hearing loss, like for example, diuretics or antibiotic treatments?
no.
Is there any history of familiar and your family of a hearing loss?
Yes, my mother wear hearing aids.
Okay, and let me ask you a couple of questions. Do you drink any alcohol?
No,
Do you smoke?
no.
What can you tell me about your diet?
I eat healthy all the time.
And what about you have any exercising routine?
Yes, I walk along, walls, every like 3 days a week.
Okay, you don't mind, I'm going to be washing my hands and I'm going to be right back with you to do some physical examination. Is that okay with you?
Yes, of course.
Thank you, Ms. West. So I wash my hands and I'm right back. I'm going to put my glove. I'm going to do today for saving time. And we're going to start checking the vitals of the patient that the nurse already took. Blood pressure says 120 over 80. Heart rate is 84 beats per minute. And respiratory rate 14 breaths per minute. So the temperature is 98.6 Fahrenheit. Okay, vitals are normal. So we're going to get a general impression of the patient. Patient is anxious because the hearing loss, but it's not an acute distress. We're gonna start doing the cardiac exam. We're gonna do the auscultation of the heart. We're gonna do second right intercostal for the aortic, second left intercostal for pulmonic, fourth intercostal left lower sternal border for tricuspid, and we're gonna do fifth intercostal midclavicular for the mitral or the the apex. Then we're gonna do the respiratory. For respiratory, we're gonna start at the apex, and then we're gonna go down, and ladder-wise manner. We're gonna cover all the lung fields, and full inspiration and expiration every time I touch you with the stethoscope. Thank you. We're gonna do this fast as we can. We're gonna go all the way until we do the base of the lungs. At the same time, we're going to be looking at the expansion of the chest and the respiratory effort. We can say that in cardiac, there's a regular rate and rhythm. There's a normal S1 and S2 at heart. There's no murmurs. There's no rubs. And respiratory, we can say both lungs are clear to auscultation. There's a symmetric expansion of the chest and a good respiratory effort. After that, we're going to start inspecting the head for any scars, sign of trauma, deformity, especially on this side of the head. And we're going to be inspecting the external ear also, looking for trauma, sinus infection, discharges, scars, lesions, Also, the external auditory canal, see if there's any sign of the extra cerumen. Then after that, we're gonna start performing some hearing tests. And for the hearing test, we're gonna start with the rub fingers. For the rub fingers, we're gonna position the hands like 2 to 3 centimeters from the ear. We're gonna have the patient they hear where we rub the fingers. Do you hear that?
No.
We're gonna do it bilateral. Do you hear that?
No.
Do you hear this?
Yes.
Okay. Do you hear this?
No.
Okay. The patient doesn't hear on the left, but it does hear on the right, which could be a sign of hearing loss. After that, we're gonna do the whispering test. We're gonna position ourselves behind the patient, like an arm length. We're gonna mask, if we're gonna test on the right, we're gonna mask the left. We're gonna do massaging of the trachea so we can cover ourselves. We can have the patient to cover themselves the ear, and we're gonna whisper a combination of 2 letters and a number. A1B.
A1B?
Okay, the patient hears well. We're gonna do the same for this ear. B1C.
No, I can hear nothing.
And the patient doesn't hear anything on the left ear, which is a sign of hearing loss also. After that, we're gonna do the Weber test. For the Weber test, we're gonna activate the 512 medical fork. We're gonna put it in the middle of the ear and see if the side lateralizes equally in both ears or lateralizes on one side. Okay, let me know if you're hearing both sides equally or one side better.
I can hear more on the right side.
Okay, lateralizing to the unaffected ear, which could be a sign of sensorineural hearing loss. And we're gonna do the Rene. We're gonna activate the fork. We're gonna put it in the bony prominence of the ear. When the patient stops hearing, we're gonna position 2 to 3 inches to the ear, see if they still hear it. Let me know when you don't hear anymore.
No.
Do you hear it?
Yes.
Okay, patient still hears. We're gonna do this the same side here.
No.
Do you still hear it?
Yes.
Okay, so we can see the air conduction is bigger than bone conduction in both ears, but it's a decreased air conduction and bone conduction of the left ear, which would be a sign also sensorineural hearing loss. After that, we're gonna inspect the ears internally. We're gonna we did it at the end purpose so it wouldn't affect or interfere the hearing test. We're gonna gently pull the pinna and we're gonna go position, get some space. We're gonna go in and we're gonna be looking at the tympanic ears. Its tympanic membrane is intact. There is no sign of sclerosis. It's normal color. There's no effusion. There's no masses. We're gonna do this bilaterally. They're both normal. And after that, we're ready to discuss what we think with the patient. And we came and we get here with the patient. Okay, Ms. West, according to your history, you are complaining of some hearing loss, and we're thinking about, according to the history, some possibilities about, like, for example, sensorineural hearing loss, or it could be, for example, presbycusis, or it could be familiar hearing loss. After performing all the tests that we performed today, we came to the conclusion that you're suffering from sensorineural hearing loss. And this could be to several reasons. For example, it could be genetic, which is not your case because you were not born with it, but it could be due to aging. It could be viral infections, ear infections, or medications you've been taking, something like that. Could be several reasons. What we propose after that is to get an audiometry test. We don't do it in the office, but we can get you an appointment with Florida Audiology, which is not far from us. They can follow up with you, and the solution for that is usually like a hearing test. Hearing test, I mean, some people don't like to use it because aesthetic reason, but nowadays with all the technology, they make it so small that they're hardly visible, but they improve the quality of your hearing significantly. Do you have any other questions for me today? Something else I can help you with?
No, thank you. You have been explaining clearly to me.
Okay. Do you want me to make the appointment for you, or do you want to do it yourself?
No, I do it myself. Thank you.
Okay, we'll give you all the information for the audiology and the doctor name, and you can do the appointment. We'll follow up with that. Okay.
Thank you.
Thank you much for your cooperation, and have a good day.
Thank you.
Okay, and this was the case of Miss Edna West. She's a 65-year-old seamstress who came to the office complaining of hearing loss, partial on the left ear, that has been progressively worsening over the last 6 months. She noticed that her husband, she had trouble hearing her husband when he talked to her, and recently they went to the movies and she couldn't even hear the dialogue. Ms. West denies any vertigo or dizziness associated with the hearing loss. She denies any ringing of the ears, any ear discharges, any ear pain. She denies any trauma on that side of the head. She denies being exposed to loud noises or also recurrent ear infections in the childhood or later on in life. She also denies taking any medications that could be the cause of the hearing loss. Um, but she admits family history since her mother wears a hearing aid. After performing, checking all the vitals and performing all the physical examination on Mae West, we came to the conclusion that she's suffering from sensory neural hearing loss. The follow-up for that is an audiometry test, which we don't do in the office, but we offer to Scale of 1 for her on Florida Audiology, which is a center that specializes in that and is close to the office here. Patient's going to follow up with that, and the solution for that is going to be to see how much hearing loss she's suffering from, and they're going to propose a hearing aid. We explain to the patients that hearing aids are much smaller now, and they're not aesthetically, it's not going to cause any problem like aesthetically for the patients. Some patients don't like wearing it, and that is going to improve significantly her hearing loss. We also explained to her about the possible causes of the hearing loss. It could be genetic causes during pregnancy, but that's not her case because she wasn't born with it. It could be also acquired, and it could be due to several reasons, like, for example, aging, which is one of the main reasons, recurrent ear infections, or medications that cause ototoxicity. And patient understood all the information, and she says she had no further complaint. She's gonna make the appointment herself, and she's gonna follow up with the Florida Audiology department. This is our case for today. Everything else was normal, and definitely was sensorineural hearing loss on the left ear for Miss Edna West, 65-year-old patient. Okay, thank you much and have a good day.